in this session, and what I'm going to talk about, once I connect this, to talk about OCT machines, the value for money. What I'm going to talk about is the landscape today, OCT landscape, the defining the value of OCT acquisition. Really, what is the value in acquiring a OCT machine? Cost analysis framework, and comparing the OCT platforms, and of course the upgrade triggers and practice sustainability. Well, if we look at the OCT landscape, we know about the first, second, third generations. We are currently using the third generation machines, but the OCT market, Indian OCT market is about 2,300 crores approximately, and the expected CAGR is about 9.5%. So there are a lot of 30 commercial platforms available, and domestic assembly is also growing now. But how does a OCT machine add value to our practice? Well, value actually means the summation of clinical outcomes, operational efficacy, and financial returns. So clinical outcomes, we know it helps in earlier detection, earlier disease detection, improved monitoring, and it reduces diagnostic uncertainties, and of course there will be better surgical planning. And as for operational efficiency, it gives a faster patient throughput. There is reduced chair time for the patient. And in terms of the financial returns, of course, that we are going to talk right away, because it opens up a lot of ancillary revenue streams. Well, if we look at the cost analysis, the purchase, I have divided into two parts, the entry level and the premium. Well, the entry level segment would be between, it's below 25 lakhs, and premium OCTs would be between 45 to 90 lakhs. Herein, if we add up all these, the annual service contract, the consumables, upgrades, and staff training, and all the reimbursements, we can expect for a break-even in 18 months for a entry level machine, and for a premium machine, maybe break-even should come in 2 years' time. Well, if we look at the reimbursement and revenue drivers, well, insurance and government empaneled rates are low, so 800 to 1500 maybe. Private practice OCT rate would be 1200 to 3000, but that is in metro cities. In tier 2 cities, it would vary between 700 to maybe 1500 per scan. Now, when we add a premium service like OCT angiogram, it ranges between 3000 to 6000 per scan. And if the average daily volume is about 15 to 40 scans per day, then it should break even in, as I have shown, in 18 months to 2 years. So we all know about this. What we actually get when we compare these machines in different levels. The mid-range ones it provides almost everything. But the real challenge is the upgrade triggers and the decision points. When do you really want to hold back to your old machine? When you want to upgrade, or what is the time to replace? When your machine is less than 5 years old and meeting almost all the clinical needs that day-to-day needs in your clinic, then it's better to hold to your old machine itself. And service contracts are all active, and reimbursement is stable, good patient throughput is there, then we really hold on to our own machine. But we can upgrade if maybe the octa capabilities are there in the same machine, and you feel that wide field modules are available and you can always upgrade. But we need to understand that the cost should be less than 30% of the device, of the new device. So that is the cutoff when you decide for upgrading a OCT machine. And as for replacement, if the device is more than 18 years old or out of support, and there are increasing downtimes, you need a lot of repairs, a lot of repair costs, and clinical capabilities are insufficient, and then you have your competitor clinics who are providing better scans. So technology leap should be, taken, and that is where you replace and a new system is acquired. The thumb rule is if annual repair costs exist, if it exceeds maybe 15 to 20% of the replacement value, then it is always, most cost effective to replace. Well, there are a lot of financial strategies to buy. You can purchase outright, or you can have an operating lease, or maybe subscription, pay per scan. So outright purchase, it's you have full ownership, but then you also have the depreciation benefit. But then you upfront you dish out a large amount of capital. That is a negative thing for outright purchase. Operating lease is good, but it preserves your working capital, and you also get the lease rentals tax deducted. They are all tax deductible, but end of the day you don't own the machine. There is no ownership. And pay per scan is again good. You have zero capital output. So but it all depends on the scale. If you have a very high volume, then it's really practical. So profitability will only be at very high volume, and of course there can be some vendor lock-ins. They will not allow you to change in between, right? So now another important topic is the sustainability. How do you really sustain OCT machine in your practice? The target ROI should be less than 3 years. So if it is less than 3 years, it's sustainable. And we have to plan. We know that the device lifespan is about 7 to 10 years. So every 5 to 7 years, the technology should be refreshed, and annual scan volume should be more than 1500. We need to calculate, and maximum repair cost threshold should be less than 15% of the device value at that point of time. So these are the key takeaways. We need to look at value in the multi-dimensional way, the outcomes, efficiency, and financial returns. Cost of ownership is not the purchase price alone. The manpower, the footprint, where you keep the machine, and all other, the maintenance. So all these are involved. And device capability has to be carefully judged. You should not overspec or underspec. Buy what you need. If you don't have a great retina setup, don't buy an Octa. It's not required. These are the small things you have to decide yourself, and upgrade before you are limited by the efficiency of the machine. So we need to upgrade on time, and we have to reflect on our cash flow. It's not just the price, the cash flow that particular service gives us. And every 5 to 7 years we need to plan for a technology upgrade. Thank you.